Hello, this is a virtual microscopy slide of a case of a ruptured ectopic pregnancy in the fallopian tube. We are looking at a cross-section of the fallopian tube, and over here is the lumen of the fallopian tube, and this area is a very markedly thickened fallopian tube wall. Let's have a closer look at the lumen. We can see here the usual normal mucosal folds, which are called plicae, that are lined by ciliated columnar epithelium. And this space here is the lumen of the fallopian tube. Surrounding the mucosa is a layer of smooth muscle tissue. Going back on low magnification, we can see that the fallopian tube wall from here to here is markedly thickened, and there are numerous chorionic villi within the tubal wall. We can recognize the chorionic villi by seeing these rounded to slightly irregular structures with a very loose myxoid central stroma and surrounded by two layers of cells. The inner layer are composed of mononuclear cells known as cytotrophoblast, and that is fetal tissue, and the outer layer is also composed of fetal tissue, but these nuclei all share the same cytoplasm, and this is known as syncytial trophoblast. In this neighboring chorionic villus, again, we can see the two layers, the cytotrophoblast, which is the inner layer, and the outer multinucleated syncytial trophoblast. In between the chorionic villi, there are large areas of blood clots, and here, for example, we can see fresh, bright red blood cells, and some of this pinker fibrillary fibrin material in between, as well as some leukocytes. So we can see that this burrowing into the tubal wall of the chorionic villi has given rise to a lot of hemorrhage within the fallopian tube wall. And in this instance, the wall has ruptured, and we can see a defect here, and there has been bleeding into the surrounding peritoneal cavity. When this occurs, the patient will experience acute pelvic or abdominal pain, and this is a surgical emergency because this can give rise to severe hemorrhage, and therefore this needs to be surgically treated. Hence, in summary, this is a case of tubal ectopic pregnancy with rupture of the fallopian tube, and we can see that in the wall of the fallopian tube there are numerous chorionic villi. These are admixed with blood clots, and we can see a full thickness defect of the fallopian tube wall with rupture and with bleeding outside the fallopian tube. Thank you.